We're expecting Deputy Mayor Cedric Alexander to appear. Monroe County Sheriff Ted Baxter is here with us this morning. Mike Mendoza, the Commissioner of Public Health for the County of Monroe, and last but not least, Chris Bell from the Monroe County Medical Society. So we welcome all of you, and again, we look forward to enjoying the morning and the celebration. And at this point, I'd like to introduce Dr. Eric Bieber, the President and CEO of Rochester Regional Health, who will share his comments, and welcome all of you as well.
Good morning, everybody. So, it's always great for these kinds of ribbon cuttings. If you haven't had a chance to go down and go to the space, take the opportunity. You know, there's something special about St. Mary's. Liz and I were just talking about that. Lee and I were just talking about it. I think from the early times when I started here and got the first tour, and they gave me quite a tour. So I got to go down and see the original terracotta that was laid by the nuns. You don't want to see this because they took me into some dark place that was very small and very MRI-like and had me kind of go like this, and it was, you don't want to go there. But it's really cool if you go. And that's St. Mary's. It's been around for a very long time, and it's quite important to our community. So I think as we talk about what's going on today, and then think about what will happen next year as we bring our obstetrics and our pediatric providers, and they'll be on this campus in the medical office building. That space is being renovated and beginning to be renovated as we speak. There's going to be a vibrancy that's going to exist here that I think is very special and quite important to the community. I want to start by thanking our board, our trustees. There's a number of them here today. People often say, you know, gosh, there's a lot of stuff getting done. You're doing a lot of things, and you're doing a lot of it quickly. And what's the formula? How do you make that work? And it starts with great governance, having a great group of board members who oversee it. And Dan Meyer, the chair of the Health Service Board, is with us this morning. He's also chair of GRIPA, the Greater Rochester IPA. It starts with having an exceptional group of leaders that I'm fortunate to be part of. And then it's really about the remarkable physicians, nurses, psychologists, and staff, social workers, and all that are so critical to doing what we do every single day. That's what makes it work. That's what makes it special. And that's what I think is going to happen down in the space that we're going to talk about. Now, Kathy McGuire isn't here with us this morning, but it was really Kathy McGuire and Jill Graziano, who you're going to hear from in a little bit. It was her vision. She's now down closer to her family in Florida. But Kathy envisioned having space that would be much more accessible to our patients. And if any of you had seen the space that was previous there, it was quite dark, old, dated. The colors weren't great, felt quite industrial. And as I walked through the finished product today, it's anything but that. And so when we talk about behavioral health and access in a crisis center, I think the most important piece is access. And when you see us opening up the Reedman Health Campus, and you see us opening up things around the community, it's really about how do we create better access, easier access for people. You know, we know that if you have access to health care, people will avail themselves to it, and they'll avoid emergency rooms, and most importantly, they'll get the care that they need and not end up with catastrophic care, which we know if you don't have that kind of access, people will sometimes put off and put off and put off until sometimes it's quite critical. And so this concept of behavioral health access couldn't be more important. You know, there's been some questions about, you know, do we have the access that we need in this community? We all know we're in an opioid epidemic, and And yet Jill and Jill's team have all sorts of access today to help us treat patients. But I think sometimes people don't realize what's here and what's available. And so working with Mike Mendoza, our county commissioner, Dr. Mendoza, Cheryl Denofel, and that team, working with the city, we're thinking about how can we do what we do better? How can we make sure that people are aware of all the things that can help them, and that there's nobody that wants to get help that we can't connect with and get them in to get the help that they need. That's about a community taking care of a community. And that's really what we're here celebrating today, is how we do that for each other. The statistics are staggering. There's close to 45 million adults in our country today that have behavioral health issues. And less than half of all those patients get the care that they need. There's more than 8 million adults that have both behavioral health and chemical dependency issues. And again, less than half of the people get the care that they need. My hope today, through a very generous gift, is that we're able to create that access, and we're able to create the buzz in the community that allows people to know they can come here, they can come to St. Mary's, they can come to any one of our facilities that you're going to hear about in a second, and know that they're going to get the kind, compassionate care that Rochester Regional Health and our community have been known for. That's really the celebration today. This is a significant facet in ensuring that for our community, but couldn't be more important. So it's a very, very exciting day. So with that, I'd like to introduce Cheryl Denofel. Cheryl has been a steadfast advocate along with Dr. Mendoza and that team in thinking about how can we be ever more creative in what we do in reaching out to people. We've had numerous conversations with Jill, Graziano, and Cheryl and Mike. I think that will continue. Sadly, I think we're not past the worst of this epidemic. I do believe that working together and stacking hands together and creating access like this, we can all make a difference. So I'd like you to give a warm welcome to our County Executive, Cheryl Denofel.
Well, good morning, everyone. I need to tell you, what a special day in the county of Monroe. I woke up this morning, as I usually do, around 4:30, and getting ready for the day and thinking about what is the day going to bring and what is the week going to bring. And I'm smiling broadly because I just could not wait to be here today with Dr. Bieber and his whole team to celebrate this momentous occasion. I have to tell you that from the moment I met Dr. Bieber, we had a conversation about what does healthcare look like in the county of Monroe. And I was teasing Dr. Bieber a little bit ago about being competitive. And he said, I'm really not competitive, Cheryl. And I said, yes, you really are very, very competitive, Dr. Bieber. And that's a good thing, because what is he competitive about? He's competitive about bringing the best health care to all of the citizens, all of the residents of the county of Monroe. And he believes, and I believe too, that it doesn't matter where you live, it doesn't matter how much money you make, it doesn't matter what your job is, it doesn't matter what the composition of your family is. This is one community of Monroe, right? We are one community. And this community works best together when we look at the community as a totality. And we figure out how to best deliver services, how to best have access to health care, how to best have quality of life handled, and best opportunities for the people who live here. And so will you join me in thanking a strong community partner, Dr. Eric Bieber, for what he's doing here in Monroe County. He's tremendous. And his whole team, Dr. Bieber mentioned Jill Graziano. I know you're going to hear from her in a little bit, but I'll tell you what, he's being very kind. Jill and Dr. Bieber and Dr. Mendoza, who's our public health commissioner, who also believes in proactive approach to healthcare and making sure that the residents of Monroe County remain healthy. We've had numerous conversations about what does that look like, right? And you can't go a day without a news article, talking to someone, maybe in your family, in your church, in your work, about this opioid crisis. Folks, it hits everybody. Everybody knows somebody, and it could be your brother, your sister, your mother, your father, coworker, neighbor. Everybody knows somebody. And as we address that, one of the biggest challenges and opportunities is to make sure that we are providing the services that we need and we have access to care, whether we're talking about outpatient treatment, inpatient treatment, counseling services, our non-for-profit agencies. No one has done a finer job than this team, and I want to thank Dr. Mendoza and Jill and Dr. Bieber and the whole healthcare system working closely with us. And today is a celebration about what we're doing to get the job done. And before I stop the thank yous, I want to also say thank you to Dave Putney, who's our mental health director here in the county of Monroe. This is a great team, and we're going to get the job done, right? We're going to get the job done because this is about the future of Monroe County. It really is about working together to provide solutions to people in crisis. I'm so grateful that we have this opportunity today. I'm so grateful that we're seeing a transformation of St. Mary's Hospital. I was talking to Dr. Maxwell, and he said he spent his whole life here. He was born here and worked here, and the vibrancy that once was St. Mary's is now coming back to St. Mary's in a different and transformed way. But today, folks, is a day about celebration, about opportunity, about stronger Monroe County, stronger families, and it's happening right here at St. Mary's Hospital. So I want to, again, thank everyone. Thank Hugh Thomas for his leadership, the board, for recognizing that together we are stronger. Again, this is one community of Monroe. I want to present Dr. Bieber with a proclamation to declare today to be Behavioral Health Access Day in the County of Monroe, celebrating Monroe County's commitment to serve the health and wellness of our joint community. Congratulations and God bless.
All right, it's a little bit up and down here, but again, welcome, and I want to introduce now, we're changing the order a little bit, our Vice President for Behavioral Health, Joe Graziano, who's going to share with you a lot more detail about this program and how exciting it is for our community. And I just also I'd be remiss if I didn't welcome, in my earlier remarks, Dr. Maxwell showed up late, candidate for Congress, Dr. Jim Maxwell, who's joined us for this celebration, and you just heard from the county executive, has a long history in particular with this campus. So welcome, Jill. Welcome, Jill.
Hi, Jill Graziano. I'm the Vice President of Behavioral Health for Rochester Regional Health. I think that the turnout here is remarkable and an example of how hungry people are to talk about, hear about, have greater access to services for those who are struggling with mental health issues and substance abuse issues. So this is our region's first center of its kind. It is a emergency/urgent care center for those that are in behavioral health crises or substance abuse crises, and it is an alternative for people going to the emergency room, which is not always the best way to access care, and is also an alternative to what I would consider the worst case scenario, which is not seeking care. And not seeking care because one does not know how to access care, or they don't even know where to start or how to navigate. And this Access and Crisis Center is really true to the Rochester Regional Health mission, which is really enhancing the lives of the people that we serve and in the communities that we serve. And what better way to bring a alternative for people to walk in and get immediate assistance to mental health and substance abuse professionals. And this is really a great time. The fall is a great time for us to open a center such as this. September is Suicide Prevention Awareness Month. September is Recovery Month. October 10th was World Mental Health Day. I don't know if anybody knows this, but I heard this morning that today's National Grouch Day. I don't know if that's relevant or not relevant, but it sort of felt that way. And none of this would have been possible without the support of Rochester Regional Health, even buying into and subscribing to this idea of something that really didn't have a blueprint of which for us to follow. And really want to thank the Office of Mental Health, and thank you for coming today, because again, there was not really a blueprint for a crisis type center for mental health services. And I also want to thank those that were really financially generous to us, because none of this would have been possible without the help of the Monroe County Office of Mental Health under Dave's leadership. Dave, thank you so much. Our local PPS FLIPS is part of the DISRIP initiatives, and the very kind and generous support from Dr. Renner and his family around helping us really transform the lower level. I also want to thank Kathy McGuire. She's in Florida with her new role. It was really her idea and vision for us to move forward. And I want to thank those that were really involved early in the process. Eve Gotham really helping us set what this could look like and what this could be. Dr. Morocco and Dr. Gardy for being the physician champions behind this around how do we respond in a way that is quick and immediate without having, how do you parse out a true medical emergency from a mental health crisis or substance abuse crisis. And I really want to, and you're going to hear from Colin after me, and Colin will act like we just kind of got this together, but there was a tremendous amount of work that Colin has done around finding the right staff, overseeing what the thing looks like, working and getting approval from the Department of Health and OMH, and just really, really proud of the work that he has done. So thank you. Thank you for coming and celebrating with us. Thank you for just being a part of this. This is pretty cool, so thank you again. And I'd like to introduce Colin. Yep, thanks. Colin is the director who oversees acute services in Monroe County. So he has the psych unit at RGH. He's got the psych unit here. He's got the staff that works in the emergency rooms, the psychiatric staff, and then now he has the crisis and access center. Though, thank you.
Good morning. Thank you, Joe. That was very nice. I really couldn't start to speak to you until I thanked a few more people, some of them repetitive, but the work that they did deserves it. Dr. Mary Morocco, Dr. Dorada Gardy, Eve Gotham, Andrew Serafine, Melissa Shoemaker, Dr. Brian Abel, the Rochester Regional Health Behavioral Health Leadership Team, as well as the Rochester Regional Health District Team. Also, the Rochester Psychiatric Center, New York State and Monroe County Office of Mental Health, 211 Lifetime, and the Finger Lakes Performing Provider System for their partnership and collaboration. All of those things combined will lead up to a crisis center that opens tomorrow morning. I'd also like to reiterate Jill's comment about Dr. and Mrs. Renner and his family that's here today. In addition to 40 years as a psychiatrist serving this community, he made a generous donation that contributed to the renovations and the furnishings of the crisis center that we'll be able to show you very soon this morning. So I'd just like to take a moment to recognize Dr. and Mrs. Renner. Thank you. Again, the Crisis Center will open tomorrow morning for business at 8 a.m. It will be Monday through Friday, 8 a.m. to midnight at the onset, with plans for the future to be 24/7. Access to treatment may be completed by simply walking in or calling. We have an outreach team that, in addition to those folks on staff, can go in the community and see people where they are. In their home, at a bus stop, wherever the need is, our crisis center can go to them. The greatest attribute of the Behavioral Health Access and Crisis Center will be its ability to transform. When we began conceptualizing the urgent care behavioral health-like setting, the theme at Rochester Regional Health was preparing for the next patient. It was that theme that raised the notion of treating both mental health as well as chemical addiction in this location, creating treatment and linkage at the same time. In a phased approach, we will have the ability to grow our outreach teams, inserting them strategically in the community, the initiation of medication-assisted treatment, and increasing our hours of operation to 24/7. Rochester Regional Health's current theme is Next is Now. And And the Crisis Center opening today and tomorrow couldn't be a more accurate time to echo next is now. The real work for the Crisis Center team begins, and we have an exceptional team consisting of experienced licensed mental health counselors, registered nurses, and patient access technicians. Thank you all for being here today. The development and implementation team truly appreciates that. I'd like to invite Jill back up as we celebrate our annual Behavioral Health Dr. Hart Award, as well as the Dorothy K. Marion Award. Thank you.
Pause. Okay. All right, I am excited to announce our winners of our Dorothy K. Marion Award. And Dorothy, I don't want to put you on the spot, but Dorothy's here with us today. And Dorothy was the Executive Director of Behavioral Health Services for 21 years. And so we have an award in her honor that really establishes and recognizes those who aspire to further their behavioral health profession and leadership skills. And I'm happy to announce that Darlene O'Brien from our drug treatment court is the winner. And these awards are great because they are nominated, people are nominated from their colleagues. And this is not coming from me or coming from anyone on my leadership team, but it's those that recognize their peers for a job well done. And some of the sentiments that were said about Darlene are that she has a calm presence even in stressful situations, that she has been awarded the Warner School of Supervision Fellow Award twice for her work with interns, and that she's currently pursuing her Master's of Arts in Organizational Leadership. Darlene, congratulations. Kind of scary right here, but I'm managing it well, I think. Okay, so our next award is the William T. Hart MD Award, and Dr. Hart was the founder of the Rochester Mental Health Center in 1967, which was the first community mental health center in Monroe County and the second in New York State. And Dr. Hart was the driving force in promoting deinstitutionalization of state-run hospitals. And so we have two winners for the William T. Hart Award today. We have Luz Degato Rhodes, who works in our pros team, and she was nominated by Cheryl Steele. And I hear about you all the time, about how great you are, what a wonderful asset, and that you're integral in assisting our Hispanic participants, that you're highly respectful of cultural aspects of participants in recovery, and that you challenge participants to adapt healthier habits. So congratulations. And then, last but not least, Dr. Mark Winsberg, who's our Medical Director of Chemical Dependency in Monroe County, was nominated by Helen Young. And some of the comments that were shared by Helen in her nomination was that Dr. Winsberg works tirelessly to improve the quality of life for his patients, that he embraces the basic principles modeled by Dr. Hart, and he consistently shows compassion for his fellow man. Congratulations, Dr. Winsberg. So now we will, I think we are, where's Colin? So we're going to be making arrangements now to have people go on the tours. Do you want to explain how that's going to work?
I'd be happy to.
Okay.
Thanks again, everybody. Please take some time to enjoy an hors d'oeuvre, do some networking and introductions of each other. We will have a team of folks who every few minutes will be taking a group of folks down to the Crisis Center. It is one floor below us. So thank you again for coming, and we'll have folks at this door for a tour.